Appreciate this, and I appreciate all the panelists being here today. At some point when this pandemic ends, and it will end, at some point people are going to list the silver lining. They're going to list the things that were good that came out of all this, and there are good things coming out of this. And one of those at the top of that list is going to be telehealth. We've heard that there's been 10 years of progress in 1 week in telehealth. In fact, prior to the pandemic, there were roughly 13,000 telehealth appointments per week. Yet we've seen an increase during the pandemic, and even a few months after the pandemic started, we saw it go up to over 3,000% of that. Unbelievable, what has happened with telehealth. We knew it was there, and I had been looking at it for years, but this was the opportunity for us to really see it flourish, and I think it's been great, and I think it's going to be even better and an important part of our healthcare delivery system. The benefits are endless. There's no questions about it. Patients with comorbidities were able to continue to get care without having to be physically present with the physicians, and we've seen it, and I've seen it work. I saw it work even before that, but we've all seen it work now during this pandemic, and it truly has been a part of the silver lining again that we've noticed. Dr. Resnick, I wanted to ask you, in your testimony, you discussed that Congress should make the telehealth flexibilities from the pandemic permanent. But I hear others say, well, we need more data, we need more research. Yet we've got a year's worth of data collection and tens of millions of telehealth visits that provide us the data to review the success of expanded telehealth services. In your opinion, is that enough? What we've experienced thus far?
Yeah, these are not new services we're providing, and the data have accumulated exponentially in the last year, thanks to Atif and other colleagues on this panel. So I think we have data to move ahead with making the expansion for visits permanent. I am all for continuing to study all of the sub areas of telehealth, because we as physicians are going to learn from that and continue to learn what things are best done by telehealth and what things we need to see a patient in person for. But that's really at the standard of care level and not the coverage level. So I think we've got a lot of data and we're ready to move forward.
Would you agree that it has increased access to care as well, particularly in minority communities even? And I represent South Georgia, which, we struggle a lot with rural broadband, and that's certainly something that we're addressing in this committee as well, and certainly something that needs to be addressed. And there's no better example, obviously, than our educational system, but also with our healthcare system with telehealth. But it does, and it also decreases costs. So would you agree that it increases access as well as decreases costs?
Clearly it does increase access. There will be instances where it is cost effective and removes cost. There are instances. When I see a patient who comes to see me from a rural area and they have something that I know I'm going to need, it's going to be chronic and I'm going to be taken care of with them in partnership for quite a while, I feel really bad when I tell them they're going to need to sit in traffic and miss work and do all those things to come back and see me. So whether it's your constituents in South Georgia and their physicians or my folks in rural California, just having the option to know that it's covered for me to be able to pick which visits are most appropriate to see them via telehealth is a huge improvement to their access.
And not only that, but just as you're pointing out, it decreases health inequities because it increases access. It helps people who are at a disadvantage because of various reasons, but some that you just stated right there.
We were in this very ironic situation pre-pandemic where there was a big growth in telehealth, but again, it was mostly the fastest growth were in these direct consumer providers, which were for people who had spare money and could go online and just pay for it out of pocket. They got access. But people who had paid into Medicare and had Medicare coverage, or many who had commercial insurance, couldn't follow up with their own physicians who knew them well and were comfortable. Right. So this has been a great improvement in terms of disparities and in terms of patients.
So basically, right. So basically, we've got the research and the data. We know that it increases access. We know that it decreases costs. We know that it decreases health inequities. To go back now, I think would be a disservice to our citizens and a disservice to healthcare in general. That's why I have I co-sponsored a bill along with one of my Democratic colleagues, the Telehealth Modernization Act, that essentially would make the flexibilities from the pandemic permanent. Common sense. We got the data. We know that it decreases costs. We know that it decreases health inequities. We know that it increases compliance and access.
Yeah.
Common sense bill.
We strongly support it, and I know my Medicare beneficiaries that I take care of would be unhappy to have this access yanked away from them. So thank you.
And once again, bipartisan, that I'm co-sponsoring with another member of the Lisa Blunt Rochester with on the Energy and Commerce Committee, bipartisan bill that we should all support, and I hope my colleagues will do that. And thank you, Madam Chair, for your indulgence.
We thank the gentleman.